Welcome to Psych on Site. We are delighted to embrace you as a new member of our organization. We hope you will enjoy and find your experience with us to be rewarding. Psych on Site is committed to providing quality professional care to patients of nursing homes and long-term care facilities through programs designed to effectively integrate mental health care services. Psych on Site sincerely cares about the well-being of its patients and values quality service. Our professional team is well equipped to not only provide consistent and exceptional care, but also to ease the mind of those who are concerned about their loved ones. We offer a peace of heart and peace of mind knowing you've made the right decisions for your patients. Psych on Site focuses on quality of care and patient-centered care in the planning and evaluation that is grounded in mutually beneficial partnerships among clients, families, and providers. Procedures used during nursing home visits. Psych on Site is committed to providing quality, professional services to all our patients under the care of our organization. Thus, it is imperative that all guidelines set forth by Psych on Site are abided by while representing our organization. The following guidelines were designed to ensure the rules of the nursing facility are followed, the facility staff is shown respect, the patients are given the best possible care, and their charts are accurate and current. While visiting the nursing facility, it is imperative to adhere to the following. Check in at the front desk and/or with the social service director to make your presence known. This may vary according to the policy procedure of the facility. Discuss any problems or changes concerning your patients with the social service director. Please inquire about all patients assigned to you to ensure that they are non-skilled, hospice, or HMO. It would be a benefit to obtain a copy of the facility census report upon availability. Review your patient's charts and/or any other pertinent information which you may be privileged to concerning your patient. Be respectful of your patient and his or her living space. Prior to entering a room, please be sure to knock on the door. We ask that you refrain from answering your cell phone during your sessions. In the event of an emergency, please excuse yourself from the room. Do not smoke with the patients. Be considerate of the weather when taking patients outside for counseling. We encourage you to see all patients that are located in the secure wing of the facility at one time as much as possible. Subsequently to your visit, please place the original psychotherapy treatment note in the patient's chart that is in the area designated by the facility. Also, please be sure to fax a copy of the treatment note along with all of the necessary documentation to the office. Upon your departure from the facility, please inform the social service director of any information as deemed necessary or important. You have the ability to treat patients from Sunday through Saturday between the hours of 8 a.m. to 8 p.m. It is recommended that a clinician does not work at a facility beyond this time band. Psych on Site requests to please be respectful of these designated hours at all times. If there is a change to the status of a patient on your caseload, you will need to complete and submit a change form to our office. The reasons for a status change of patient can include the following: passed away, discharged from the facility, or the patient is no longer a candidate for this service. Please be clear and concise as to the comments of the change in status because the accuracy of this information is essential, and it is used to update our records internally. As the treating clinician, it is your responsibility to notify our office of any change in the status of your patient. It is imperative that all billing is submitted to the office within 72 hours of the service date. A complete billing packet consists of the following documents: activity report, psychotherapy super bills per patient, and psychotherapy progress notes and/or initial assessment per patient. Each document submitted with the billing packet must be completed in its entirety. All dates should be consistent, and all psychotherapy notes must be signed and dated accordingly. Moreover, it is essential for all psychotherapy notes to report the time of service, begin and end. In regards to licensed professional counselors, also known as licensed mental health counselors, or any psychotherapist requiring supervision, please make sure to obtain the signature of your assigned supervising clinician, clinical psychologist, or licensed clinical social worker prior to the submission of your notes to the billing department. We provided two options for your submission of your billing packets: fax or email the corresponding information. It is imperative that you verify the status of your patients with the facility's social services department on a consistent basis, preferably weekly. If a patient is on skilled, Part A Medicare, hospice, or HMO, the Medicare will not provide reimbursement for services performed during this time. If you fail to verify the status and are paid for performing a service prior to our office receiving notification of the claim denial, or there has been an overpayment, we will be at liberty to deduct this service from your next paycheck. The reason for overpayments can include the following: the patient was in skilled nursing, or the patient was in hospice. In the event that a deduction is to be made, documentation confirming the denial of the claim can be provided upon request. Skilled Medicare Part A. Medicare Part A benefits are typically referred to as hospital insurance. Skilled or Part A care is given when a patient requires skilled nursing or rehabilitation staff to treat, manage, observe, or evaluate care. Medicare uses a period of time referred to the benefit period to keep track of how many days of skilled or Medicare Part a patient uses and how many days may be available. Benefit period 100 days. A benefit period begins on the day a patient begins using hospital or skilled nursing facility benefits under Part A of Medicare. Generally, a patient goes on skilled after a hospital visit, and patients on skilled can get up to 100 days of S&F coverage in a benefit period. Thus, it is imperative that you obtain prospective date that your patient's skilled or Part A coverage is set to end. Hospice. Hospice is a program of care and support for people who are terminally ill. Under Medicare Part B, providing a clinician is not reimbursed for performing services to treat while on hospice. Thus, it is important that you discontinue treating any patient on hospice immediately upon notice. HMO. A HMO is a type of health insurance plan that usually limits coverage and generally will not cover out-of-network care. Psych on Psych does not accept patients enrolled in an HMO. Thus, if a patient on your caseload is enrolled in this type of insurance plan, it is imperative that you discontinue treating him or her immediately upon notice. Pro bono services. Pro bono services are generally available for patients that have insurance that is not billable by Psych on Psych. It is imperative that all pro bono patients are treated only once per week under the 16-minute billing code procedure. Our organization will not bill or be paid for these services. However, we will reimburse you as long as the service is provided only once per week. Typically, Psych on Psych will allow pro bono services for only a limited number of patients per facility unless our Director of Operations provides approval to do otherwise. Initial Assessment, Section 1. An initial assessment must be conducted before any treatment begins with a patient. It is recommended that a clinician gradually build on case conceptualization in the notes section and describe the client's baseline in a few sentences or words. For example, under general background, it would be helpful to briefly elaborate on reasons for referral. Example, what are presenting symptoms? How long has the client been experiencing these symptoms? Possible precipitating factors? To what extent this represents a change from client's baseline. Under physical appearance and general health, it would be helpful to elaborate on issues checked. For example, if the client reports feelings of pain, details regarding the severity of pain, functional limitations due to pain, how clients cope with pain would be helpful. Or if, for example, lethargic is checked, details regarding whether this represents a change, how this affects daily living, how the client deals with the changes is valuable information that should be documented. If the notes sections provide additional details on issues checked that are essential and concise. A treatment can begin only after a patient has had an initial assessment and is deemed appropriate for services. Please be aware that Medicare does not reimburse for the billing of these consecutive days. Therefore, it is imperative that there is a day between services concluding for initial assessment. Otherwise, payment will not ensue. Psychotherapy Progress Notes, Evaluation and Management. You will utilize the Psychotherapy Progress Notes for treating the patients on your caseload. It is important that all treatment notes are written legibly and without any whiteout. All treatment notes must begin with a 10-point scale rating on the patient's self-perceived mood status, not only for the suicidal patients. It is necessary that you address your objective for each patient and or emotional concern of the session, and that you document what took place during each treatment session. For instance, please note if the treatment session consisted of discussion only, inspirational reading, current events, teaching a game, etc. The note that you provide should be essential, state measurable goals, and frequency of events. Treatment plan reviews. All patients are to be seen contingent on their treatment plans, which are generally devised at the time of the initial assessment. For instance, if a patient's treatment plan requires for a patient to be seen twice per week, then it is imperative that the patient is seen twice per week so that we remain compliant. If for any reason you have to deviate from the treatment plan, please document your explanation for doing so. Also inform the office in advance of your inability to see your patient as consistently as required by his or her treatment plan. Treatment plan reviews are to be updated every 90 days. In order to reassess the patients, you will use the treatment plan review and update form and the psychotherapy progress note. The treatment plan review is time-based. Therefore, the correct billing code is dependent upon the time that you spend performing the reassessment. For instance, if you spend 45 minutes performing the reassessment, then the appropriate code to bill would be CPT code 90834. The treatment confirmation report allows us to track your activity and keep an accurate account of all patients being treated by our organization. Please submit your treatment confirmation reports to the office via email or via fax. Treatment confirmation reports are due for the previous work week every Monday by noon Central Standard Time. It is imperative that this document is completed accurately and in its entirety. And for any particular reason you are not able to see a patient, then the cause is to be noted on this report. Quality care meetings. Each month you are required to meet with the facility staff regarding the patients on your caseload. This meeting can be face-to-face, through a teleconference, or set up in conjunction with the care plan meetings held at the facility. These meetings will be referred to as quality care meetings. This meeting will allow you to discuss the patients on your caseload as well as answer any questions the facility staff may have. The facility staff can include the social service director, administrator, or director of nursing. It is to your advantage to discuss all of your patients on your caseload at this meeting. In the event you don't discuss all of your patients, you will be required to treat that patient after the meeting. Also, you must record your discussion in the treatment notes regarding your patient and bill under the procedure code for family without patient. This is not a code of time. Lastly, the expectation to treat patients under the treatment plan is not reduced when the quality care meetings occur. Psych on Psych primarily bills Medicare. You will be notified of the patients assigned to you whose only source of billable insurance by Psych on Psych is Medicaid. Each state listed below has a specific number of therapy sessions for Medicaid patients in a calendar year. Our office will keep track of the number of visits each Medicaid patient has received from you in order to request additional therapy sessions. New patient referrals. It is recommended that interviews, evaluations, and therapy sessions are conducted only with those clients assigned to you by Psych on Psych. If you're requested to see a client who is not on the caseload assigned to you, please contact Psych on Psych immediately for prior approval. If the referral is an emergency, please contact Psych on Psych immediately to discuss details and procedures required. Once the appropriate measures have been performed by our office, we will refer the patient to the clinician who has availability. Under no circumstance should a clinician obtain a new referral without first communicating with our office. If you are interested in acquiring more patients, please communicate this to our placement coordinator so that this information is made known upon receipt of a new referral. Refusals. If a patient refuses counseling services, it is recommended that the clinician attempt to see the patient at least 3 times. If after the 3rd visit the patient is still refusing services, we close the case and complete the recommended documentation.